All right, to all who are new here, welcome to Releve Sports Medicine's Virtual Journal Club. For additional webinar educational opportunities, you can visit our website and register directly for the webinar, or you can sign up for our email list to be notified of upcoming webinars. We're continuing to update the schedule, so check back often. For all athletic trainers who are intending to get live CEUs from the VOC, you will receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz, evaluation, and assessment. You will have up to 72 hours to complete the quiz and the evaluation. This email will come from customer care at gotowebinar.com. Please ensure that this is done to receive your statement of credit. If you don't receive the follow-up email or you have any other concerns, then contact us via our email at journalclub@relevesportsmedicine.com. Once the statement of credit is available for download from our website, you will receive an email notification. If you have any questions during the webinar, please submit the question and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slides and you're accessing the webinar from your mobile phone, swipe the screen to the left or to the right and the slides will become visible. The PowerPoint for today's talk is available for download from the dashboard. The recording will be available for review from our website tomorrow. Our speaker this evening is athletic trainer and physical therapist, Robert Panariello. Robert has been a speaker for countless conferences, including EATA, NATA, and APTA. He was awarded 2016 National Strength and Conditioning Association Sports Medicine and Rehabilitation Specialist of the Year. In 2015, he received the award from the American Academy of Sports Physical Therapy Clinical Educator Award. And he was elected as one of the inaugural inductees to the USA Strength and Conditioning Coaches Hall of Fame. One of his notable publications related to this evening's topic is Closed Kinetic Chain Exercises for Rehabilitating Hamstring Injuries, which was published in the Athletic Therapy Today. He will be speaking today about rehabilitation and performance enhancement training for hamstring injuries. I'll let him take it away.
Thank you, Dr. Henny. Can you, how do we get my PowerPoint back up?
We're looking at it and we can hear you, no problem.
Yeah, but, okay, let me. Okay. All right, got a lot of information to cover, so I would get started. This one. Oh. I'd like to thank Dr. Henny and her assistant Brittany and my friend Fred Danisco for having me on this evening. I have no financial disclosures to report, and also like to thank all of you for taking the time to hear what I have to say. So we're going to speak a little bit about hamstring injury, and this presentation is going to include our philosophy here where we are with regards to rehab and performance enhancement training of athletes, the running gait cycle, athletic performance principles in the sports rehab setting, then obviously hamstring injuries and the rehab and the performance training after their rehab. So our philosophy is such, and I just want you to think about something. I don't know if they made a 2020 Volkswagen Beetle, but did the Beetle change from 1950 to 2019? And the answer is yes, of course it did, right? Mechanically, technology, etc. And the same could be said from a 1980 to a 2020 Mac computer. The parts on these machines have changed through the years, right, due to improvements. If you look at Bill Russell, professional basketball player in 1950 versus LeBron James, the parts on these machines changed. You know, does LeBron James have two hearts with three legs? And of course he doesn't. And so the question arises, the anatomy, the nervous system, the physiology of athletes having changed over the decades, then should the basic philosophy of how to train or enhance these physical components of athletes really change? Not regards to advancements in exercises or modalities, etc., but just what is necessary to enhance their performance. And so I think it's important to note there's a difference between athleticism and skill. And in the rehab setting, when we train athletes, we enhance athleticism, right? The physical qualities of strength, power, elastic abilities, which we'll get into, and speed, where skill is the ability to do something with an expertise, shooting a basketball, pitching a baseball, hitting a baseball. And so we enhance athleticism. Just because we enhance an athlete's vertical jump does not mean we enhance their shooting percentage or their shooting accuracy. Athleticism versus skill. So here's a young athlete we train in our performance center. He's sitting on an 18-inch box, and he's going to jump up to a 49-inch box, right? So play the tape. He sits. He jumps up, right? He's very athletic. He has great athleticism. He's strong. He's powerful. He's explosive. He's fast. The problem is he's a single-A baseball player. He's way low in the minor leagues. He doesn't have the baseball skills to make it to the major leagues. Great athleticism, low skills. So when we talk about athletic performance, and that's confers with hamstring injuries and hamstring abilities, speed is conferred basically by two factors: the amount of force we place into the ground and the amount of time we place that force into the ground. And so if you look at the research, the fastest athletes in the world spend the least amount of time on the ground, and the fastest athletes in the world put the most amount of force into the ground. If you look at world-class sprinters, their ground contact times are less than 1/10 of a second. And they'll have 5 times body weight at impact. A lot of force into the ground, short period of time, where marathon runners have 3 times body weight over a little bit longer duration. They have a longer contact time on the ground. If you look at sprinters again, coming out of the blocks, they have a very high contact time, right? They're starting from 0. But as they hit maximal velocity, they have a very low contact time, right? Slow linear velocity, high contact time, high linear velocity, low contact time. And when we look at athletics, we'll see that the majority of this occurs in reaction and acceleration, right? The ability to start and accelerate. 64% of these speeds occur in these phases, where maintenance of maximum velocity or the ability to achieve maximum velocity is about 30%. So if you look at Isaac Newton's law of motion, right, which will confer with this, for every action in nature, there's an equal and opposite reaction. So the athlete, regardless of what we're rehabbing them for in the lower extremity, hamstrings, ACL, labral repairs of the hip, they have to reestablish their ability to not only put force into the ground, but to react to the reactive forces from the ground back upon the body. And this is imperative for acceleration, deceleration, and the athlete's ability to change direction. So what we use in our philosophy is a hierarchy which was developed by a good friend and mentor named Al Vermeil, who's a Hall of Fame strength and conditioning coach. And his hierarchy is as follows. He does an evaluation and a testing process with his athletes to determine their goals and needs. And then he develops a work capacity. And what that means is the ability for the athlete to exercise repetitively over time without inducing excessive fatigue. And that could be in a workout, that could be in a week's workout, that could be in the plan of 3 months. We have to develop a work capacity, because with excessive fatigue, bad things happen. Loss of kinesthetic sense, loss of application of force, etc. And then there's different physical qualities: strength, explosive strength or power, elastic reactive strength, or sometimes people think of that as plyometric, and then speed. And what's important is that we've developed these physical qualities in an order so that you have optimal performance of the athletes. What's also important is that each physical quality is dependent upon its predecessor. So for instance, if we define strength as the ability to produce force and explosive strength as power, we put a velocity component into there. Well, if an athlete can't produce force, how are they going to be able to produce force quickly? We've adapted this model in rehab by adding mobility and movement. So if you think of like an ACL reconstruction, we have to restore gait, get rid of crutches, restore range of motion. And then muscle re-education occurs, right? You have androgenic inhibition of the quadricep. We got to get that quadricep firing. So once they achieve their full range of motion, or the necessary range of motion to perform an exercise and have their muscles firing appropriately, then we could work on work capacity, and then go through the hierarchy of the physical qualities. And we've published on this. So if you look at a 100-meter sprint, we talked about, right, force into the ground in the shortest period of time. Well, when you start out of the blocks, that's mostly dependent upon the strength levels of the athlete. And then when they become explosive, or they start to build up their accelerated abilities, that's strength plus explosive strength or power. And their ground contact times go down as their velocity goes up. Then they start to rebound from the ground. They become elastic. They bounce off the ground. And we'll talk about this. And then they hit top speed. So if you look at this in reverse, well, if you want to have an optimal velocity, you have to have optimal elastic reactive abilities. And if you want to be optimally elastic, you have to have optimal explosive abilities. And if you want to be optimally powerful, then you have to have optimal levels of strength. And that's the hierarchy. We look at the running gait cycle. The stance phase is only 40% of the cycle, looking at one leg, where 60% of the cycle occurs with the foot not on the ground. And so that contributes to the float and the swing phases. Float where neither foot's on the ground, and the swing phase where only one foot's on the ground. So when we look at the stance phase of this 40% phase, we have an initial contact, a loading response, we have our mid stance, and then terminal stance for a push-off for propulsion, for our velocity. And so with only 40% of the cycle occurring at these phases, we better put a lot of force in a short period of time. Again, we have initial contact, mid stance, the gentleman to the right. We could see mid stance, he's in line with the body, and then toe off, which is propulsion. That's where your ground reaction forces are going to give you velocity. Propulsion begins as the heel lifts off the ground to toe off, and then we go to toe off and we get into swing. And what's important to note is that your swing leg approaching ground contact is in triple flexion, while your propulsion occurs with the leg, meaning the hip, knee, and ankle, are at triple extension. So let's talk about hamstring injuries. So when we talk about the hamstring muscle group, we know that the lateral hamstring muscle group, the biceps femoris, is involved with the majority of all hamstring injuries. There's reasons for that. We also know when we do ACL reconstructions, we take the semitendinosus and possibly gracilis tendon, and that creates an imbalance, placing more stress upon the lateral hamstring muscle group, which without ACL reconstructions in normalcy is the majority of all hamstring injuries. And we know hamstring injuries have different grades from normal 1, 2, and 3. Hamstring injuries occur at a rate of anywhere from 12 to 16% of all injuries in athletics. The most common in male soccer players, and the re-injury rate is reported as high as 22 to 34%. Hamstring strains are a real problem in athletics. And we have some modifiable and non-modifiable factors that you can see here. And this presentation will be made available for you. So I don't want to get into too much of this, but what is important to note that the most consistent risk factor of having a hamstring injury is having a history of a previous hamstring injury. And that's why it's important to rehab this injury appropriately. There's a study looking at Australian rules hamstring injuries in Australian rules football players. 2 years post-injury, running at 80% max velocity, there's a 46% deficit in horizontal forces. And when you sprint, if you sprint 100 meters, horizontal forces play predominantly in the start and the acceleration phases, where vertical or elastic forces occur at late acceleration and at maximum velocity. So 2 years post-op, you still have almost a 50% deficit in ground reaction forces with regards to horizontal forces. Another thing you should look at in chronic hamstring injuries is the rotated innominate of the pelvis. And I haven't seen too much on this. This is more empirical evidence. When we look at our chronic hamstring athletes that keep coming back, we know that there's a normal rotation of the pelvis during the gait and sprinting, right? And when an innominate becomes stuck and it's unable to come out of this position, There's limited movement, and this may be a contributory mechanism for hamstring injury. And the reason being is that you're either stuck with an anterior or a posterior pelvic tilt. So if you have a neutral pelvis that functions appropriately, you'll have theoretically, a normal leg length. If you're stuck in a posterior pelvic tilt, you've shortened the leg. And thus, to make an analogy, and nothing against accountants, if you think of accountants sitting doing taxes during tax season, their hamstrings will shorten. So when you're running and you have an appropriate foot placement, that hamstring is going to be overstretched because it's starting from a shortened position. If you have an anterior pelvic tilt, that leg is now lengthened. And now you've created tension in the hamstring because it has been lengthened along with the lengthening of the leg due to an anterior pelvic tilt. Thus, when your foot is appropriately placed on ground contact, you may have an overstretching of the hamstring because you're stuck in this anterior pelvic tilt. So if you have an athlete that's chronically pulling their hamstring, check the rotation, check their pelvis and the possibility of a rotated innominate. And here you are. So if you have the midline of the body, your foot should land about 8, 10, 12 inches, depending on the individual, anterior to the midline of the body. And that will occur with a neutral pelvis tilt. Again, with a posterior pelvis tilt, you'd have a shortened leg length, an anterior pelvic tilt, a lengthened leg length, both resulting in an overstretched hamstring at this foot placement. Mechanism of most hamstring injuries normally is the terminal swing phase making ground contact, going from eccentric, hitting the ground, and now we're going to go concentric to that propulsion or that toe or phase where muscles absorb high ground reaction forces. Remember, in rehab of any lower extremity injury, it's not only applying force, but the ability to tolerate reaction forces. And we're going to have these high reaction forces in the concentric stance phase. There's also neuromuscular factors. It's not just about getting strong and powerful, it's about timing. And if you look at sprinting, the biceps femoris, its muscular tendon length, peak length, is synchronous with peak EMG activation. With the semitendinosus of the medial hamstrings, then peak muscular tendon length occurs significantly later than their peak EMG activation. Thus, the biceps femoris is exposed to more of an instantaneous high tensile force, and maybe one of the reasons why is the commonly injured hamstring muscle. The important point here is that they're asynchronous, and that's normal. If you look at running speeds of 80 to 95 max velocity, you have an increased activation of hamstring muscles in late swing and no changes in kinematics. When we're at 95% or top speed, 100% max velocity, there's a significant difference in peak muscle activation time in the biceps femoris compared to the semitendinosus. And this complex neuromuscular coordination occurs at maximal running velocities, meaning maximum EMG or maximum activity occurs, it's not symmetrical, it's asymmetrical. Biceps femoris in this study looks predominantly activity is in middle to late swing. With a semitendinosus, its predominant activity is in terminal swing. And so again, there's more asymmetry in a normal firing hamstring muscle group. When you have an injured hamstring, to compensate for the injury, these firing patterns become more symmetrical. They fire maximally at the same time, medial to lateral muscle groups. And we don't want that because that establishes a less economic hamstring activation, a lower strength endurance capacity, less force production, and again, may increase the risk of re-injury. So again, I could go study after study. Early stance and acceleration, EMG of biceps femoris is greater than semitendinosus and semimembranosus. Late stance phase, terminal mid-swing, as we start to go into the backswing of max speed, higher EMG of the medial hamstring muscle group. And so the functional demands of the medial and lateral hamstrings differ at different phases of sprinting. Asymmetry is normal in sprinting. Being symmetrical, firing with the hamstring groups, is not symmetrical. Another factor not often spoken about, I don't even know if there's evidence to prove this, this is just a thought process and empiricals talked about, is that the biceps femoris is a two-headed muscle, just like the biceps of your arm. And these two muscle groups have different nerve innervations. And so how do we establish the timing, appropriate timing of these nerve innervations, and even in the same muscle group that has two separate heads? Right? And the reason, and we'll get into how we're going to do that. We know after ACL reconstruction, that athletes 1 to 6 years post ACL reconstruction have interlimb activation differences. They're more symmetrical and hamstring firing time compared to just normals, not other athletes. And so we have to reestablish this asymmetry along with strength, power, elastic abilities, etc. So when we want to restore these neuromuscular contributions, right? How do you restore timing at high velocity? You have to train at high velocity, but you just can't have somebody day one go out and sprint at max velocity, give their maximal effort. You have to go through a progression of velocity to reach optimal velocities. And that's something we'll go over this evening. So if we look at the physical quality strength, to get back to this hierarchy, it's important to establish strength not only in the hamstring musculature and the lower extremity, but the hip and the core musculature as well. Now, why is that? Because we want to have an optimal hip height at the time the foot hits the ground. If we have an optimal hip height, we don't paw the ground normally. We punch the ground, and the hamstrings are basically a hip extensor and sprinting. You'll have greater force production, less horizontal braking forces, less eccentric load on the hamstring muscle group with an optimal hip height, which is important. And we have a longer lever arm on the ground to produce more force. If our hip drops, the foot is going to land more anterior to the body than it should. And we're going to paw the ground, or instead of acting like a hip extensor, our hamstring is going to act more like a knee flexor, pulling the body through. We're going to have greater horizontal braking forces because we're going to come below the knee, and we'll look at that in a second. Greater eccentric load on the hamstring because we're acting more like a knee flexor than a hip extensor, and a shorter lever arm on the ground, resulting in less force produced for propulsion. So if you look at this young lady on the left running on this treadmill, and you look at her right leg and versus the gentleman to the right, you're going to see two things. One is the guy on the right is probably going to produce more force into this treadmill because he's stepping over their knee. His right leg is going more in a circular pattern, and he is an optimal hip height to apply force into the ground, more of a hip extensor versus the young lady to the left. Her heel doesn't even come close to her rear end or her butt. And watch the heel height of the gentleman to the right, and that's a factor too, which we'll get into in a second. So you'll see she's running, going at normal speeds, but you can see his heel is going high up on his butt, and he's as we slow it down, he's getting a greater optimal. He's got an optimal form of his running style. Young lady to the left, look how low her hips are. Look at her heel height, how low it is. And here it is in slow motion. She's more oval. We don't want that. We want a more circular pattern of stepping over the knee and applying our force into the ground anywhere from 8 to 10 inches, maybe 12 inches anterior to the midline of the body. So with proper vertical hip height, which is dependent upon strength, we're going to have reduced contact time with greater forces put into the ground, as I started off. And I'll probably say this a million times. The best athletes in the world, whether you're throwing, hitting, swinging, running, jumping, are the ones that put the most force into the ground in the shortest period of time. And so we don't want this negative hip height. We don't want them as they're running, whether it's through prolonged period of time in a game situation, being in the fourth quarter, or where it's a 100-meter sprint. We don't want a dropping of the hip. We always want a positive displacement of the hip during their running pattern. So what happens with this hamstring injury? Something else happens, right? Is that we have a tearing of soft tissue. Healing occurs via muscle scarring. And unless you're an embryo, your muscle is going to heal during scarring. all right? If you have a heart attack, you have scarring. If you have tearing of the muscle, you have scarring. And what scarring occurs is that we have a shortening again of these muscle fascicles. What a muscle fascicle is it's an arrangement of 10 to 100 muscle fibers in each fascicle. And if we have scarring, then when we place our foot in the appropriate position at ground contact, again, we're going to be overstretching this hamstring because scarring creates a shortened muscle. So we want to reestablish fascicle length. One thing we may do is that we may have to look at sciatic nerve, right? Sciatic nerve can get trapped in scar formation and can restrict performance. So you can do one thing, one of two things. What I'm going to show you is muscle tensioning, or you could do nerve flossing. And we do that in part of our rehab, and I would recommend you do that as well to make sure that the sciatic nerve is not entrapped after a hamstring injury and scarring. So she's going to be forward, and she's going to look up, dorsiflex and plantar flex to get nerve tensioning. If she plantar flexed when she brought her head forward and then extended when she dorsiflexed, we'd have more flossing. So that's something to consider with regards to nerve glides. Again, with scarring and a shortened hamstring muscle, or these shortened muscle fibers that have been damaged, peak hamstring torque occurs with shorter muscle lengths and injured hamstring. We don't want that. We want optimal muscle lengths for optimal hamstring torque. And so therefore you have potential weakness at these longer lengths, and so you're susceptible for injury. So what do? We do eccentric training in the lengthened muscle state that may shift the torque curve at the end range of motion or at foot contact. And so traditionally, what will we do? We hear things about Nordic hamstring exercises. And we know there is research out there that Nordic hamstring exercises do reduce the incidence of hamstring injuries. I'm not going to argue that, but very rarely will a person be able to get all the way to the pad and be fully extended down. They're just not strong enough, especially in an injured state. And so what you need to do is you need to say, okay, how am I going to stretch this fascicle, this contribution of multiple muscle fibers bound together? Because the fascicle is much stronger than the muscle fiber. Think of it as a rope versus a single thread within the rope. How am I going to strengthen this at terminal knee extension with load? And so one thing we do is we put somebody on their back, we put a cuff around their ankle, we use a cable column system, and we have someone assist them with the concentric portion of this knee flexion exercise, and then the patient does the eccentric exercise on their own. And you could do this with a knee extension machine as well, or knee flexion machine as well. It's not so much strengthening alone as it is to establish fascicle length with some strength at the terminal knee position. So this way you don't have such a shortened or scarred hamstring by reestablishing this fascicle length. That's one exercise we would use, and probably a very simple one. Reason why we do this, Tim Tyler did a study. He looked at 50 athletes with hamstring tears. He did a similar thing. He used a knee flexion machine, or used a Cybex that he went at 90 degrees or 100 degrees of hip flexion, and then extended the knee out to full extension to stretch the hamstring from that position. And 42 of these 50 athletes at 2 to 3 years later returned to sport without a subsequent re-injury of their hamstring. 4 athletes sustained injury at 3 to 12 months. But what he found, these 4 athletes were 4 of 8 that were non-compliant with their physical therapy. And so it's important for people to go through their rehab and complete their rehab. The compliant people, the 42 athletes who were compliant with their physical therapy, was 7% stronger at longer hamstring muscle lengths, and the non-compliant 8 people were 43% weaker at the longer hamstring muscle lengths. So the exercise I just showed you was comparative to the type of exercise that he did. The other exercise we use is something called the Romanian deadlift, where you hold a barbell and you just extend the hips backward while keeping neutral spine and lowering the weight either to the level of the knee, we work to the mid-shin, and then to the floor. I'm not going to tell you how to do Romanian deadlifts. You could look that up, but it'll strengthen the low back. It'll strengthen the glutes. And if you look at the angle of the knee and the hamstrings, that is the same angle at the knee that occurs at mid-stance, where we have to support the body weight over the foot. So that's another reason why I like using Romanian deadlifts or RDLs with my hamstring rehab. If you have a medial hamstring injury, kettlebell swings have been shown to have a higher EMG activity than other exercises. So if you're rehabbing a medial hamstring injury, you might want to think of kettlebell swings, which also has a propulsion as the kettlebell goes up, and a deceleration component as you're bending the knees and you're slowing the kettlebell down as it returns to the ground surface. If you look at other exercises for the lateral, with the biceps femoris, the traditional barbell deadlift has very high EMG activities, followed by the trap or the hex bar deadlift. So if you have a medial hamstring exercise, you want to do your general strengthening as you may traditionally do, and maybe incorporate kettlebell swings. If you have a biceps femoris injury, maybe eventually you start to do deadlifts when appropriate for your athlete. When we look at elastic and explosive type things, you're thinking about plyometrics. We use Olympic weightlifting and their derivatives, different types of jumping regards to plyometrics again. And don't forget something, that sprinting or running is the purest form of plyometric training. You have an eccentric, a semi-quasi-isometric, and then a propulsion concentric with running. So running is the purest of all plyometrics. Well, one thing I want to caution you about is this. We went through the hierarchy, right? And we talked about a 100-yard sprint, how strength is followed by power, and then you become elastic, right? Once you hit a certain velocity. And that velocity is 7 meters a second, or a little over 15 miles an hour. So if you run a 4.640, your sprinting velocity is about 9-10 meters a second, all right? Which is going to bring you up to close to 20 miles per hour. If your athlete cannot hit 7 meters a second or 15 miles an hour, don't place the emphasis in your rehab on plyometrics, because they're not getting to the speed requiring them to be elastic, and you're trying to train elastic abilities. They have to be strong enough and powerful enough to reach 15 miles an hour, and then you could play. So if you go through that again, are they strong enough? Are they powerful enough? And then are they elastic enough to hit top speed? Don't just go by the protocol saying, like in an ACL reconstruction, at 12 weeks, we can start running. It's not that you can't start running, just make sure they're strong and powerful enough to run effectively. So what do we mean by elastic qualities? Well, if you turn the bicycle upside down, I wanted to get this wheel spinning, the front wheel spinning, in a counterclockwise direction, right? I would grab this tire and I would throw it, and the wheel would start spinning. But I can't keep grabbing the tire to try to make it spin, because I'd be slowing it down. So I might slap the front of my tire with my hand, faster and faster and faster, and that wheel would spin at higher velocities. Well, if I'm running from left to right, it's the same thing. As I go through this circular cycle of running, every time my foot hits the ground, I rebound off it. I rebound off it. I rebound off it. That's what being elastic is. And you become, when you hit top speed, it's not that you're applying a mechanical application of force, you're rebounding from the ground surface. That's the ability to be elastic. That's what we're talking about, being elastic and sprinting. And so we have to establish with our rehab, right, strength, power, but we have to establish linear velocity and neuromuscular timing again, right? We have to reestablish that asymmetry of firing patterns between the medial and lateral hamstrings. And we do this via swing phase, float phase, stance phase of the running gait cycle. One thing that's important is that we have to be able to reestablish, this is real important in your ACL patients, the heel position at the buttock, right? Because we want our athletes to step over the knee. And so that heel position is important for that type of cycling, as I just mentioned with the bicycle tire. If we have the heel far from the buttocks, we're not going to be able to step over the knee as a cue. We will go under the knee and scuff the ground and also make ground contact further than we should to the midline of the body. And if you scuff the ground, you're probably going to lose 1/100th of a second per stride in your sprinting. A stride being 2 steps equals a stride. Left, right is a stride. If it takes you 8 or 9 strides to run a 40-yard dash, you're going to be 0.8, 0.9 tenths of a second slower just because of a biomechanical disadvantage. It has nothing to do with strength, power, or elastic abilities. So we have to restore that foot placement at the buttock. When you're running and it missed mid-stance, that's your heel position. It's not out here at 90 degrees or 100 degrees. And why that's important is because running is a cycle, if you have a bad swing phase, which is the backside mechanics, you have a bad front side mechanics with your stance phase. If you have a bad left leg, you have a bad right leg. And so you've got to restore optimal running mechanics. So again, as I said, poor stance, poor swing, poor running cycle. Poor left leg, poor right leg, poor running cycle. And so what we do is we run through a track and field coach named Gerard Mach. And you can YouTube what's called mock drills, M-A-C-H, mock drills. And it's our clinical, he has A, B, and C running drills. We only use the A series with our hamstrings because we don't want to overextend the hamstring with B and C drills. But our clinical progression is we've modified these A drills into A walks, A marches, A skips, and A runs. And then eventually we get running into 10-yard sprints. So again, as this leg goes through a swing phase, it's going to make contact from the midline of the body anywhere from 8 to 10 inches, give or take. But if that's the vulnerable position of hamstring injury, we want to avoid that position in our rehab when we work on high velocity training. So you want to keep the foot behind or at the midline of the body, avoiding this anterior vulnerable position where hamstring injuries occur. So A walks, A marches, it's a simple means of controlling this running mechanics. We're trying to get the athlete to get their running mechanics, teaching the swing leg to come to maximum height, use vertical forces into the ground, and avoid that vulnerable position. It also is going to work on classical tissue alignment as the foot goes up and down, kind of like a CPM does with a knee after surgery. So here's an example of A walks, A marches. Watch. When her foot lands, it's going to be within the midline of the body, avoiding that vulnerable position anterior to the body. And we're just teaching her step over the knee and put force into the ground. And it's real easy. It's just an A walk, stepping over the knee, alternate arm pattern, and teaching them to place force within the midline of the body. Then we'll progress to what we call low A skips. And what we're trying to do is teach the athlete to put force into the ground, increase the tempo of the foot and the stride or the stepping, and avoid that anterior position of the limb. So a low A skip is the thigh is not going to exceed a 45-degree angle. And what's the difference between a low A skip and an A walk? Velocity and force into the ground. Now we're starting to put force into, and see how she's rebounding? We're trying to become elastic again. And we're trying to establish that timing difference between medial and lateral hamstrings. Then we'll go, this is what an A skip is when you look at mock drills. And what will happen is the thigh will approach a 90-degree angle. So what happens? Increased velocity, more force into the ground because the limb is traveling a greater distance now. Then we'll get into A runs. So now we're actually going to start running, right? We're increasing velocity, more force into the ground, avoiding that vulnerable anterior to the midline foot contact position. We're preparing for stride frequency, like I said, and we use step over cues. We may tell them at first, only step over your ankle, and then progress to step over the calf, and then again progress to stepping over the knee. So here are some 8 runs. And again, greater velocity, more force into the ground, enhancing that neuromuscular timing of the hamstring, medial to lateral. And we'll run 10 yards, 5 to 10 yards, and get feedback from the athlete. How do you feel? Then we may want to do resisted A runs. And so what happens if you resist someone doing A runs? If you resist somebody and have to overcome a resistance, they have to put more force into the ground. And to do that, they have to travel with higher limb velocity. The other thing this is good for athletes that have kinesiophobia, that have the fear of putting force into the ground because their focus is on overcoming the resistance, not loading the limb. And you'll see if you resist somebody, even on an A walk, they'll be more focused on putting force into that leg that previously they were afraid to load. So A runs. Velocity, force, neuromuscular timing. Once your athlete can do those things without any pain or discomfort, then you're going to start using some 10-yard sprints. And the reason why we limit the sprint to 10 yards, well, the reason why we use 10-yard sprints is now your athlete is actually sprinting. The reason why we limit it to 10 yards, it's usually up to 10 yards where the foot will stay behind and at the midline of the body. Once you pass 10 yards, that foot approaches that vulnerable position of hamstring re-injury, which is anterior to the midline of the body. So watch this young lady's right limb. She takes off behind the midline of the body, foot strike at the midline of the body, foot strike at the midline of the body, and then she stops. Now she's about, this is the 10-yard mark. This is our performance center where we train athletes. This is our 10-yard line mark. That's about 12 and a half yards. You can see how her foot is down in that vulnerable position past the midline of the body. That's why we shut it down at 10 yards. And we'll do sets of 10-yard sprints, 10 times 10, maybe 2 sets of 10 times 10. And then eventually, when they can run at full speed, 10 yards repetitively over time, then we'll take them out 15, 20 yards to achieve that vulnerable position. And if they have any problems, then horses out of the barn. Feel free to resume your normal sprinting of 30, 40, 50 yards. Take her on a football field. We're going to go from the 40 to 50-yard line. Watch her right leg. All out sprint, right? And watch the heel height. Foot's behind the midline of the body. No cause of alarm to injure the hamstring. Midline of the body, heel height's coming up to the heel, midline of the body, heel height's at the butt, midline, and then stop. Shut it down at 10 yards. So when you go through this hamstring return to play, you've got to do a good evaluation. You have to be able to establish a work capacity and then take them through this hierarchy. They've got to develop strength and then focus on explosive strength and then focus on your plyometrics and then put it all together and focus on speed. It's not that you can't train all these physical qualities at the same time. It's just where are you placing your emphasis? So as I stated before, don't focus on plyometrics and being elastic if they're not strong enough to reach a speed to become elastic. Focus on the physical qualities that are going to get them to that speed where they become elastic, and then increase their elastic abilities. And then you also need a progression of sprinting, which I've tried to show you some of the things we do, as well as the establishment of fascicle length, so that when the foot placement is appropriate, you're not overstretching the hamstring, but you need a progression of velocity so that you reestablish the normal asymmetry of normal neurological firing patterns between the medial and the lateral hamstring. So that's all I've got. I think I've got about 45 minutes or so. If there's any questions, I'll be happy to take them. Thank you so much for taking your time. I hope I've given you some things that you can use with your athletes.
All right, thank you. So we have some questions coming in here. I'll start with the first one that's coming from Jody. And she says, asks, what is your approach for incorporating lateral movements for acute and chronic hamstring strains?
Okay, so we have a general rule that's pretty simple. We try to keep things as simple as possible. 2 legs before one, linear before change of direction, and slow before fast, right? Because that's a progression. If you have an athlete, let's say someone, a baseball player, the first base, and they can run the first base in 3.3 seconds. Well, then when they make their turn, let's say they make the turn at a velocity of 2.7 seconds. Well, if I can get them to get the first base in 1 second, that probably will also increase the velocity when they change direction. So change of direction is a skill. I'm not saying we don't work on it, but I don't work on change of direction until I'm comfortable with linear velocity. If they can run without pain and pretty good mechanics at pretty good speeds linearly, that's when I'll start doing change of direction. And again, I also believe empirically, it's my experience, that if your athlete also gets faster, their change of direction also correlates, will get faster as well. So it's how they do linearly, which determines when I start change of direction. They got to be pretty good linearly.
Okay, perfect.
I'll tell you one more thing on change of direction. If you do a lateral hop, like if you put somebody on a track and just from a standing position, like they cock and then they jump sideways, see how many lanes or how far a distance they can move laterally. The people that can move the furthest laterally are usually the people who are fastest linearly as well. So that's why I'm saying hip strength is empirical, is really for linear velocity. It's really important. And for change of direction as well.
All right, wonderful. Okay, I've got a bunch of thank yous coming in, saying that fantastic presentation. I want to give folks the opportunity, if you do have any questions here. I saw that there were a couple of hands raised, although I wasn't able to see if there was any questions associated with those. If you do have any questions, please feel free to put those into the question box here.
And if you do have any questions later on or tomorrow, my email is on this last slide. If you give me 24 hours to respond, I promise I will respond. So if you think of something later on, you could just email me as well.
Mm-hmm. A question's coming in here from Peter, asking about the best way to assess work capacity.
The way we work, the way we assess work capacity is we do something. Now you can start people on stationary bikes if they're really sore. Then you could use an upper body ergometer. The way we establish work capacity, and you could look this up and YouTube it, we do something called Javork complexes, which is lifting a very light weight with a barbell through a number of exercises for a number of repetitions. So let's say we have 6 exercises and 6 repetitions for each exercise. So we may do something like, and that would be a total of 36 reps in a set. So we may put 15% of someone's body weight on a bar, and they may do something called like a muscle clean, do an overhead press, and bring the bar to their shoulders, back squat, to an RDL, to a good morning, to a bent over row or something like that. And so when they could do 3 to 5 sets of those Javork complexes, then they got a pretty good work capacity. The reason why I like using exercises, by doing different exercises, you're teaching technique, you're getting mobility, and you're building some strength. They're called Javork's complex, Jorvek.
Okay, well, you will receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz and evaluation. You do have 72 hours to complete the combined quiz, evaluation, and assessment. If you have any questions, this is our email address. Our next upcoming lecture is going to be on November 17th. And if you want to, rather than checking back on our website, if you want to just go ahead and register for our email list, you can do that. And this is the email, the website address. And I'd like to thank everybody for coming. And thanks, Mr. Panariello, for an excellent talk tonight.
Thank you for having me. Very much appreciated. Everybody have a good evening, and thank you for your time and your attention again. Good night.